Welcome back. It's still Mama's Nest, proudly brought to you by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. My name is Fome Ejumudo, and I still have with me right here Grace as well as Sophia. Grace has shared so much of her expert knowledge. According to her, like I said earlier, she has lost count of the number of babies she has birthed. As well as Sophia, she has also shared some of her experiences. I hope you've learned a lot because every baby is peculiar. The experience you go through with one baby is different from the other baby. Yeah, so you were walking us through the different stages of labor. Explain how we would understand, how any mother out there would understand.
Okay, the first stage of labor is the latent phase. That is, the mother is feeling the pain, but even the health practitioner can't feel the pain yet, can't even ascertain if you are in labor.
That's the point where you go to the hospital and they send you back home. But why are you people like this? Why are you people like this? I'm feeling pain. Take me in and watch over me. But they send you back home, and sometimes, most of the time, you people say it's false labor. Yes. So she must be screaming and shouting and cursing.
No. Why? Because the reason why we send you back home is, at the long run, when the time is prolonging, you tend to now ask the health care worker or the support person, the husband is, nurse, what is happening? We've been here since morning. So instead of you counting the time in the hospital, so go home and count the time. When it's time for us to start counting, let's count together.
That. So as not to waste
the time. And so as not to get you agitated. And sometimes the labor might not even have started. It might be a first labor. And you might even go home and come back after 2 weeks.
Wow. So that latent phase is like a false labor.
First labor. So from that 2 cm, you already, that is your cervix, which is the gate into the uterus, can accommodate 1 finger. And as at that time, you can still cope with the pain. You can still be eating, be drinking, though you're having the pain.
You still be at home, chilling.
You can even be in the hospital, be gisting, and still be walking around. You can even watch movies. But when it gets to 4 cm, that is when we call active stage of labor. So that at that time, the cervix can accommodate 2 fingers. So we now say you are in labor. So as at that time, you need a support person.
Is there a time difference between latent and active?
Latent phase, you cannot say
time frame.
No.
Sometimes
it can even take days before you enter into the 4th cm. So, but when you're at the 4th cm, we expect it to dilate
faster from there.
So, and what happens during labor is that when you feel the contraction at the top of the uterus here, majorly you feel the contraction starting here. Even your nurse, anybody can see the baby putting up. Yes. So when the contraction starts, what the baby does is the baby lifts up the body, lifts the buttocks, and push the head on the cervix. So the cervix is like an elastic part that needs to expand for the baby's head to come. So you are not the only one in labor. The baby too is in labor.
Come out.
Yeah.
He has to do everything possible.
What happens is, the more the intensity of the contraction, the more the baby's head becomes applied on the cervix.
So that's the pain, right?
That's the pain you feel.
I feel like going to the toilet.
I feel like a stone wants to come out. I feel like something big is about to burst out.
Wow.
So when you get to 4 cm till you are 8 cm, you might just need 1 support person.
And the pain increases.
The pain increases as the dilation comes. So when you're at 8 cm, you no longer need 1 support person. You might need like 2 or 3. Because as at that time, they are telling you to wear your clothes and you're like, I don't need clothes. At this time, I just need Jesus to come down. I just need God to come down.
Sometimes you're cursing and swearing.
Like, because at that point,
singing. Like the woman that stayed in labor from the night I got to the hospital till I delivered Wednesday morning, she was still there crying and singing. And they were like, You still not moved. She's still on 3 cm or 4 cm. I don't know, but she was in pain. And they
So
said,
we're
where's
actually
your
going to talk
husband?
about those kind of cases where
They don't dilate.
the dilation is not happening
Take
as it
so-
should. So what you are taking us through now is the normal process.
Process stage.
Yes.
So at the point when you get to the 8 cm, you're already entering into the expulsive period.
Okay.
That is, at that point, you're already feeling the baby's head on the perineal area. So
Okay.
most of that, at times you say, nurse, I want to push, and it
not
is not
push.
time to push because the cervix has not fully dilated. The cervix is like
okay,
a
they're
rubber.
telling you now that they want to push.
Yeah.
All right.
But it's not yet time. The cervix is like a rubber that needs to be finally taken up.
Oh,
So when it's not finally taken up, the baby's head cannot come.
Sounds like mechanics.
Yes. If you force it
amazing.
open, it could tear. And it can
Okay.
start bleeding even while the baby is yet to be born.
So, but how do you really know all this? Because you can't see the cervix. So how are you able to determine, okay, it has finally come up, or how do you know exactly when it is time?
Okay, we call something dilatation, we call another effacement. Effacement
Okay,
means the
effacement.
cervix will be taken up. As it's being taken up, it's a different thing for the cervix to be taken up. It's a different thing for it to expand.
Okay.
So as it's being taken up, it's also expanding.
Expanding.
And some people, it will be expanding, it is not taking
It is
up.
not taking.
So some
kind
people
of-
still have to go through the process of, even after it is fully dilated, you still have to wait
You have to wait
till it is taken up.
Wow.
So some people will be saying, the baby's everything is free, just for the service to be taken up.
And it's something that has to happen naturally.
That's to happen naturally. So when we check the V, that is the vaginal examination, we check.
Okay, that's how you find out
That's how
when
we
it's
find out
taken up.
it is
It's
taken
time.
up. Oh, everything is
ready.
ready now.
Ready.
So
And the
now
baby's
push.
head is, we call it crowning. The baby's head is
Crowning.
here.
You're seeing it.
Wow.
You're seeing it at the perineum. You can now
You
push.
can now push. What a journey. What a journey. Like, what a journey.
Seriously.
It's amazing. It's amazing.
And at the expulsive period, we have a reflex. You cannot control it.
Yes.
That's how you tell the nurse, if whatever you're doing, I will push this baby.
That's what I did, yes.
I'll push this baby regardless.
So you don't care
Either
about the
you want it
instruction
or not,
anymore.
I'll just push it. Because at that point,
the woman has an actual reflex where
a reflex
it's
at that
time,
point,
it's time. You know
she
that
cannot
it's time.
control the reflex again.
It's true. Because I felt
just
that
push
way.
it,
That was
that's
my
fine.
last
Push it.
baby. I knew when it was time. They left me. They said, you're not ready. I told them, I said, my labor does not last long. So be around. Don't go too far. That's what I told them. And it wasn't long afterwards. I felt that reflex you're talking about.
Yeah.
When you feel it, you will know
You
it. There's no other
definitely
feeling
know
like
that
that.
it's
And so I was like, okay, the baby's here, get the nurse, and they all came in, and it's really amazing, giving
so-
birth and the whole process of just life in general. So in some other cases, you have like late labor, you're past your due date, nothing is happening, you're waiting for the baby. You've taken long walks.
Exactly.
They say do exercises. Were there some exercises that you did?
Dance.
Okay, you danced. What else did you do?
Then the long walk. It
Long
was that
walks.
long walk that,
Okay.
it was on that day
That
I took the
induced
long
you?
walk that.
You think it played a
Yeah,
part
it did,
in-
because I actually made up my mind to walk so far. I took a very long walk.
Yes.
I would
they
usually take
recommend
something like
walks.
5 minutes. I took like 15 minutes.
Okay.
Longer than the usual. So I think I started feeling somehow later in the afternoon. So I knew that, it's like this walk had done
Has actually
something.
worked. Yes. You usually recommend long walks, sometimes light exercises.
Yes, when cases like that happen and the baby is already postdated and or about to be postdated and you are not seeing any sign of labor, we try to put some things in action to initiate the labor. What happens is we have different individual bodies, and some people, even during their examination, everywhere is already, the cervix is already soft already. Why some, it will still be strong. So it still has to do with some things that were done during pregnancy.
Oh, really?
If you don't have proper exercises during pregnancy. And some people stay away from sex during
During
pregnancy.
pregnancy.
So it would not help to initiate labor on time.
Okay, on time,
So
on time.
there are
So
a lot of factors that could be. It could be that the baby is big.
okay.
And even as the little contractions is coming, the baby is just collecting and resisting it, that I can still accommodate this.
Enjoying.
So until
enjoying
something
the
greater than
contraction.
what the baby can accommodate comes, before the baby is okay, it's that time. But if the baby is big, the baby can actually still accommodate those.
And sometimes I also understand that the doctor has to induce a woman. At what point would the doctor have to induce the labor?
Before induction, the doctor will have checked if the cervix is favorable for induction. Before inducting, they would have checked the mother's health, and they induce because the mother's life or the child's life can be a risk or a threat for any one of them. So it's time for this baby to come out. Is that the fetal heart rate, that is the baby's heart rate is dropping. There's fetal distress already, or the mother's BP is getting up, or even the mother is getting agitated.
That's true.
Like, okay, let's initiate this labor.
So in your case, were did you get up to your due date? Were you induced?
I passed it by 6 days.
So for your twins?
Yeah, no, for the first child. So I was to deliver on the 17th, and they were like, if you've not delivered by 25th, that's like 8 days after the due date, just report, pack your things and come. So I was like, no, I'm not going to wait for induction. So that's why I started work. I started this works on the 20th, 21st. I just started working. So it was on 23rd. I said, I pray this thing will happen today. I have just 1 day before 25th. So I now started, I think I started by 8 a.m. or so. I worked. I didn't get back till like 9. So it must have been.
It must have played a part.
I worked for a long period of time. Then when I got back, I was like, because I still stood and, rested in some places before I now finally came home.
And for the twins, what was the experience like?
Oh, for the twins, they had already given me a date. So I was like,
So you walked
I'll
in like
wait
a visitor.
Till then. So I was like, I would go they told me to come 2 days to the day. So I just started feeling feverish on a Sunday. And I'm like, what's going on? I called my auntie, who is a pharmacist, and she was like, you can't be having a body temperature of 38 degrees. Why? That's not okay. You need to hurry to the hospital. By then, I couldn't drink. I couldn't do anything again. So everybody was afraid. What was going on? I need someone that was I was still doing a lot of chores. I was
And how many weeks were you?
I was already, I was about to be 36 weeks. So I was like 35 and some days. So I was like, they just rushed me to the hospital on Monday morning. Everybody that was there, including the student doctors, were checking. And we're like, I don't think she's in labor. So they said, no, it's a false labor. And they checked me and said, this is something else.
For pregnancies for twin like that, we don't wait till they get to 37 weeks.
Yes, I think I also know
so that's why they told me to come.
So that's why they asked you to come.
So they just admitted me and said, well, you will just stay here till that particular day. And on that morning, they just rode me to the theater. I said, okay, I'm going to get them out.
All right, ladies, we need to go on a quick break. But we'll be back shortly. It is still Mama's Nest, proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. We're going on a quick break and we'll see you shortly. And we are back. It's still Mama's Nest, powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. My name is Fome Ejumudo, and I still have here with me Grace and Sophia. We've been talking about labor, the almighty labor. What you should look out for, signs and symptoms, and effective coping strategies, pain management systems that you can employ when your labor kicks in. Now, we're still going further into the discussion. I don't think that, to be honest, I don't think one episode is enough to, enough to talk about everything that labor entails. It's not enough time. But you see, when they are checking the cervix, please, I'm using this medium to appeal to you nurses and doctors in general. Is there no way to make it less uncomfortable and less painful?
Oh, you mean during vaginal examination?
During the examination, when you're checking how much the woman has
Exactly.
dilated.
Yeah,
It's
it's
so
Put their
uncomfortable.
entire like
It's so,
you
it's so like, come on, this is
no
somebody
during
that,
during vaginal examination to check the cervix. We only use 2 fingers.
are you sure it's only 2 fingers?
Yes,
It
only
feels,
because
two
it
they
looks
use
like the
to
whole
like
finger is entering. No, we are using only two
it's very
fingers. And it's
uncomfortable.
painful because of the nature of the cervix itself. Cervix is highly vascularized. So
Okay, and
anything
sensitive.
very sensitive, anything
yeah.
that touches it sends a painful signal. That's one thing. And we cannot use lubricants. Why? Because
Okay,
we cannot introduce anything into that place because of sepsis.
Okay.
So that you don't come down with infection.
with
So
infection.
it is a very aseptic technique. You have to be very, very careful. And you
Mhm.
have to make it very clean as much
As much
as
as
possible.
possible.
So
Just
that
for the
is why
safety
you see
of,
us, we don't use a used glove, we don't just put anything. We even swipe everywhere very well before we
before you.
go in.
Because sometimes it's like you just want to be wicked.
Ah,
Am I lying?
no.
That's what it feels like sometimes. Like you just want to be wicked and you are not sensitive. That's what it feels like sometimes. But I do understand that you are doing your job and you're doing the best that you can as a medical personnel.
Yes.
But there's also some women, Sophia, when they're in labor, they shout, "I won't try this again. I won't do this
This is
again. I
my
will
last-
never do this. This is my
this is my
last
last
time."
time.
Before you know what's happening like this, after
The
less
following
than
year, they are
So it's
here.
just like joy
back.
comes in the morning after you give birth. You know, you
You don't
forget all
forget
those
the
Do,
pain.
do
drama.
you actually forget the pain?
Yeah, I think I did after sleeping. I woke up and it was like,
That
oh,
soon?
after sleeping, I just, it was like a dream,
Dream.
It
like
was
all
like
the
a
shouting
dream.
and fighting and, drive this
You
car
recovered
now.
quickly.
So, but I'm like, I remember that I was shouting at someone. I have to tell him sorry. I have to say sorry
You recovered very
because I know I
quickly.
was shouting. Well, I
Any
was like, oh,
tears or
thank God.
anything you had to still pass through. And there's also this pain
Yeah, the
after
pain is still
childbirth.
there.
There's when the
The uterus is
the
trying to
uterus
go
is
back to its normal
contracting.
position.
Yes.
That I
The pain is
couldn't. Oh my
excruciating.
God, I couldn't pee. I was like afraid. It's like as I'm peeing, it's like pepper.
Yes.
It's
No, I think that comes
terrible.
from the
From the
tear.
perineal
Oh
tear.
yes, so
That
that
comes
was
from the
it. So I'm
tear.
like,
Actually, the major things that happen after during postpartum, call it
Okay.
postpartum now because your baby is here,
Out,
Okay.
is
yes.
that the uterus it's a pelvic organ. It's an
Okay.
organ that is here, but because of the big baby and everything, it moves into the abdominal
Oh,
cavity.
yes. It takes
So
up
now
more
that
space.
it sends away all the organ, it sends the bladder backward, all other
So everything is
organs
going back to its
backward.
position.
So everything is trying to be like, oh, we are free, we are going back to our position. So you
Yes.
feel that process, and the uterus too will return back to
start
its.
to,
They call it
contracting.
involution. So the uterus returning back, you will still be feeling nose. Why is
Yes.
that my stomach is still as if I
still
want to
feel
give
a
birth to
little
another
pain.
baby?
exactly.
Then the perineal tear, we've sutured and everywhere
That's just
it
the
is a
worst.
wound. So when
It has to
anything
heal.
touches it like water or
Especially
anything,
urine. Urine
Oh
is
my
salty,
God.
so
Salty,
it's
so-
obviously
It's
going
not something I
to.
ever want to remember.
It's going to
That
hurt a
pain.
bit.
So it's
But
like
what can help with the what methods did you use to help with
the
the
seat
pain?
bath, right?
Okay, seat
So
bath.
and people were you're hearing stuff like you should use hot water. At the end of the day, we confirmed that we shouldn't use hot water, right?
Is it hot water or
During
warm
seeds
water?
birth, you should use warm water that your
Warm
body
water.
can
Can you imagine?
accommodate. So you just put
Not
in
hot.
Epsom salt or any
Yeah,
salt,
salt.
and then you add Dettol or your
Yes,
Savlon.
yeah.
Okay.
Then you sit on it comfortably.
Okay.
You can put the bowl into the toilet seat and sit on
alright.
it comfortably.
How often?
I think till
Just
the
till the tear is
Like how often in a day? Once
till
a
the
day,
thread
twice a
fell.
day?
Till my thread, I think I was doing it for more than a week or so, or
Okay.
more than almost 2
sometimes
weeks.
you don't need for the sutures to fall off because many of them will come back and say the sutures has not fallen off. I still have thread on my body. No, we have the body is going to absorb it. The one we use is the one the body will absorb.
Oh, I see.
Okay, it doesn't
I
fall
see.
off.
It doesn't fall off.
Yeah.
Okay.
So since we're talking postpartum, please, what is it? What is that thing you people are always packing after the baby comes out? Okay, so after the baby comes, you do the you bring
You
out
bring out the
the
placenta.
but what are you people packing? I don't understand. Does the body not by itself expel whatever is left there? What are you? That thing
Okay.
is painful and it's very uncomfortable as
Apart
well.
from the baby that has a life that can come out on its own,
Mm-hmm.
every other thing has to come out with the help of a midwife or a professional. Why? Because the placenta does not have the mind of its own to say, let me push through.
Okay.
Even the baby still has the mind of, oh, let me do this
The
way.
baby has that
There's
wisdom.
a space here. There's a
Yes.
space there. Let me go through. But the placenta doesn't. So you have to bring it out. Then after that, the uterus is an organ on its own. So it has deciduals. And the placenta, from wherever it is pulling up from, it attaches the mother and the child together. So wherever it is pulling up from, there are residuals there, even from the placenta. Sometimes from the placenta, and other products of conception. And if you don't bring them out, they can lead to postpartum hemorrhage. That is, the person will continue to bleed, even if it is a tiny bit that remains. So actually, we do our best to make sure we remove a large amount from the uterus. However, the drugs we give, we push out the remaining one,
the
automatically.
drugs.
But sometimes when the drug cannot even do it, you will still see the person bleeding.
All right.
So that's why we say we still have to maybe re-explore again to put the woman back, to bring back the product of conception.
So can you tell us, Sophia, how your process was, the CS process? What was it like?
Okay, so I think when I was rolled into the theater, I don't know what you call them. She'd be the chief midwife. So she was at my back, and she said, "Okay, so I'm going to." She didn't show me the syringe, but it was very big.
It was very big.
I think it should be as long as this and fat.
Yes,
so she said, "I'm going to give you. It's going to go into your spine. Don't jump." And unfortunately, I was coughing. I had malaria and I started this terrible cough. And when you're doing an operation, you shouldn't cough.
Yes.
So because I was going to affect both and even the doctors that were already working, so they were like, I should breathe in that cough, and I just kept, and the entire place was cold, extreme. So she said, you see, don't worry. Now you're going to feel numb, and you are not going to. You shouldn't talk, don't say anything. But I was still trying to. So maybe I just started saying, my legs, I can't feel my legs. They said, yes, you won't feel, you're going to be numb from here down. I'm like, I'm so uncomfortable. So it was like, my top was normal and the rest of my body was dead. So it's like, you are now divided. I saw myself like, oh, it's only this place that is working and this side is dead. So it was when they started pulling the babies and they're like, why did you jump? I said, but you just removed. They said, oh, yes. So you could feel that. They said, oh, this is one baby. And the second one didn't cry. So I still spoke. Is he alive? They said, why would you be asking such a question? I said, because the sister was screaming her voice out, and this second twin was just on his own, like he was just not ready. So they're like, he's awake. They just tapped him and he moved a bit, but he didn't cry. So
how long did it take you to recover from the numbness?
I think it was like the whole day.
Okay.
Because when immediately I left I was still awake until I started shivering. I had this terrible fever. I'm sure you've seen some of terrible fever.
It was one of the side effects.
Yes, it could be a side effect of a particular medication given to you.
So I shivered, and another thing that made me so scared was I saw someone she was receiving blood. So, and I saw 2 pints. So that already killed me. Like, are you sure I'll be normal when I come out? Blood. And so my husband was already panicking, and they heard him calling someone that he's afraid. And I heard her scream at him, why would you do that? She will be fine. Just hang up that call and relax. So he was worried. He didn't even think, because they didn't call him to take the baby or to see them. They just told him to go out while they roll me back to the ward. But I think after a day, I picked up and I was okay again.
You were better.
Yes.
So please, can you walk us through the process of the epidural birth, the CS birth, and when a woman has to take epidural?
Epidural is done during safe vaginal delivery. Anesthetic is what you were trying to say. Epidural is one of the pharmacological aspects for helping a mother vaginal birth not to feel the pain at all.
Okay. During normal vaginal birth. All right, I see.
So you're saying what I took is anesthesia?
Anesthesia was given to you.
The one that numbed her from?
Yes.
Okay.
The epidural is the one done during vaginal delivery.
During vaginal delivery, so the woman doesn't feel the contraction,
the pain,
but she can still push.
Yes, she can still push
and give birth. So that's also optional. The woman can decide.
It's optional, but it's not good because it tends to affect a whole lot of things that at the end of the day might make the labor process not successful.
So can you tell us some of the disadvantages?
Disadvantages is that it could lead to distress.
Okay.
Some of the medication could affect the CNS of the baby, that is the central nervous system of the baby. Wow. And sometimes you could tap into the dura mater of the abdomen during the administration.
Okay.
And the mother could, for days, be feeling headaches, severe headaches, even after the birth. So it's good, but if it's not properly done, the effect could be way more. The disadvantage is always more than the advantage.
Do you have a lot of patients that opt for epidural?
Epidural is very, very expensive.
Oh, I see.
It's very, very expensive. And in Nigeria, or let me say in this part of Africa, we prefer to go through the child because it makes us feel
like a superwoman.
So that's the part where they believe you give it like the Hebrew woman. I'm like, I don't think there's any format to this Hebrew woman talk that people.
Some people are like that. When they feel just a sharp pain, they come to the hospital immediately.
Yeah, I had someone ask me, why didn't you push the twins? And I looked at her,
Somebody asked you, why didn't you push it?
And I'm like, do they push twins anymore?
They don't push twins anymore, but in time past, they push twins.
Yeah, so she was looking at me like,
but the reason why they don't push twins
is because...
Oh, not at all.
The reason why we don't push twins these days is because we've had cases previously while we lose one of the twins.
So it's safer.
To go through the... since it's not a death sentence. I mean, some people just opt for CS because sometimes labor pain for some people don't have any threshold for pain. So they go into psychosis. When I mean psychosis, they run into mental challenges for life because of the labor pain.
For life?
Yes, we call it puerperal psychosis. Some people come out of it. Some people run into postpartum depression because of the labor pain.
Wow, because of the trauma from the labor pain. Oh, wow. Like, it's been such an interesting conversation here on Mama's Nest, discussing labor, effective coping strategies. What are the signs to look out for? Thank you, ladies. It was quite eye-opening once again, especially hearing from the medical perspective. I'm happy we had this discussion. But let me state quickly that the things that we have mentioned here, the stories we've shared, the expert advice also shared, is not to make you scared. Please, it is not to make you afraid of the process. Exactly. The childbirth process, the labor process, is a completely natural process.
Thing.
And one thing that we don't get told often enough is that your body has what to do. Your baby also knows exactly what to do to get birthed. So it's not something you should be scared of. Like I said earlier, you can create the kind of experience that you want to experience right there in your head. Pray about it. There's so many women that have walked the path before you, so you'll be just fine.
Definitely not the last.
Thank you. Yeah, certainly not the last. Certainly not the last. Thank you so much to our guests. Thank you. I had fun talking about this. You brought a lot of memories as well. And thank you to our audience. You guys have been awesome. Thank you for watching. Mama's Nest is proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. Don't forget to drop your questions, leave it as a comment, or send it in as a message to any one of our social media handles now scrolling on your screen. My name is Fome Ejumudo, and I will see you next time on Mama's Nest. Until then, bye. And don't forget, Mom, you can do this.